please reach out to us at the county and city, and we will work to get your questions answered. For clarification, Cuyahoga County and the Board of Health will still hold its media briefing this Friday at 2:30 p.m. in anticipation of the Thanksgiving holiday next week. A media advisory and call-in information for that briefing will be sent out tomorrow and Friday. With that, we will go ahead and get started. We will begin today with County Executive Armand Budish. Thank you.
Thank you. I'm here, virtually of course, with Mayor Frank Jackson, Cuyahoga County Board of Health Director Terry Allen, and Cleveland Health Department Brian Kimball. We're here to provide you with an important announcement. Today, Cuyahoga County and the City of Cleveland, along with our boards of health, are announcing a stay-at-home advisory. Terry Allen will go into some of the details of this advisory in a moment, but first the mayor and I want to address this most critical issue. Folks, our cases are going up, way up. I know the mayor and I have both made very strong statements about COVID. We've asked you, we've begged you to mask up. We've asked you to limit the size of your gatherings. We've asked you to let employees work from home if they can. We've asked a lot of you. And look, I know we're all tired. We're tired of this, but we can't let up now. We're in the fight of our lives. More Ohioans have died of COVID-19 than in the Korean and Vietnam Wars put together. And it's getting worse every day. By next week, our Board of Health is projecting we'll be hitting 1,000 cases a day if we don't do something now. At the rate things are going, our hospitals will be overwhelmed. We're under attack, but we're not helpless. We know what we need to do to slow the spread. We were successful at this in the spring, and we can be successful now. We just have to do the right things. Wear a mask, wash your hands, avoid gatherings, and yes, this means Thanksgiving too. And stay home. Unless you need to go out for work or for other essential needs, stay home. Governor DeWine has strengthened his public health orders, his mask mandate, and issued a curfew, which starts tomorrow. He's done this not only to save lives, but to also save livelihoods. Because if we can't get this virus under control, we're going to have to shut down again. And that'll be devastating to our local businesses who've already been pounded by this disease. And if our local businesses close, we'll go back to seeing unemployment go through the roof. We'll see friends, family, and neighbors all suffering. They'll be suffering untold economic hardship in addition to health hardships, even beyond what we're seeing now. I know we're asking a lot of you. We wouldn't do this if we didn't believe it was absolutely necessary. As we head into Thanksgiving week, I know this is such a hard time to ask you to stay home, to stay away from gatherings. But please, let's take the long view. If we do this now, all of us together, we can truly have something really important to give thanks for. Thank you. And now I'll turn this over to Mayor Jackson, who's been a great partner in this battle against COVID. Thank you, Mayor.
Well, thank you, County Executive. First of all, I want to thank you for your leadership on this, and thank you for coordinating this press conference so that we can jointly say to the people that the stay-at-home advisory is something that we take seriously, and we take it seriously because it's in everyone's benefit. As you mentioned, the governor will be his curfew will start tomorrow evening. The stay-at-home advisory will be effective in the city of Cleveland tonight. We will follow your lead on this. And what we will do in the emergency proclamation that we have, we will extend that proclamation to the end of this year, and we'll end that proclamation. We'll adopt what you have come forward with in terms of the stay-at-home advisory. We know that these things that we're asking people to do is a burden, and that it will require they're voluntarily complying with these things. But we also know that if they do, then we will be able to stop or at least level out the community spread and cause some decline in the infection rates. As you mentioned, County Executive, it's basic rules. Stay at home. And now we're encouraging people more than just saying we're encouraging them through this advisory to stay at home. Unless you have to go out, and the advisory will be specific as to what conditions will allow that. And if you have to go out, wear a mask, keep your social distance, and wash your hands constantly. So again, County Executive, I appreciate your leadership, and we in Cleveland are here in support of that. And we will again put into our civil emergency, adopt your approach, and we will have that out tonight, and we'll have that extended to the end of this year. So I thank you very much.
Thank you, Mayor. You've been a great leader in this. Thank you. Terry, are you on the line?
I am. Thank you, Executive Budish, and thank you, Mayor Jackson. I'm glad to be here with you today. Sorry, the camera technicalities we're working through, but you'll hear my voice here to share a message with you. So just a couple hours ago, our Board of Health passed an advisory to the community, along with a number of other urban counties around the state that are sounding the alarm. As we know, we're experiencing a dramatic increase in the number of SARS-CoV-2 virus cases across Ohio and certainly across the United States. This unprecedented surge of severely ill patients requiring hospitalization documents COVID-19 disease severity and concerns with diminished local hospital bed capacity. That's a very big concern. We want to make sure if people have to go to the hospital, that they have somewhere to go and that they can be cared for. Staff aren't out sick because they're dealing with COVID themselves. Our positivity rate is at 15% and climbing. We've heard of hospital positivity rates in testing for COVID as high as 20 and 30%. And so we know also, tragically, we saw 50 deaths in the first 2 weeks of November. In our jurisdiction alone, that's 3 or 4 deaths a day. And we've now also seen between 500 and 600 cases reported a day in our jurisdiction on most days this past week. For every case, 2 or 3 contacts that require follow-up. The models from Case Western Reserve University that help us understand what may come in the next week or two, those models have been accurate, and they're showing potentially 1,000 to 2,000 cases a day, 1,000 to 2,000 cases a day across the county if we continue on this trajectory in the coming weeks. Our staff are beyond capacity regarding case investigation and contact tracing, and we're now forced to triage our response based on these unprecedented volumes. Clearly, additional guidance, advisement, warning, and intervention is warranted to mitigate this dramatic increase. It's now more important than ever that we follow the state and federal guidance, and the steps that we take now, today, to prevent the future spread of the virus will save lives. We have a duty and obligation as public health professionals to do all that we can, working with our partners at the Cleveland Department of Public Health to protect our communities. And so it's our intent with this resolution is to take the governor's lead through his recent activation of the curfew and provide additional guidance. We're faced with could become a very significant humanitarian issue right here in our community if we don't act now, and we have to pull together as a community. So among the order components, as has been described by Mayor Jackson, Executive Budish, is we want you to stay home and to the greatest extent possible. You can go to work and school or for essential needs like medical care, purchasing essential items from the grocery store, the pharmacy, preparing food and the like, but otherwise limit your travel. You have to presume anybody you come in contact with out there now, you should presume that they could be positive. We have so much transmission, and you should act as if you're positive. Avoid traveling in and out of the state and forego having guests in your homes or residences during the upcoming holiday season. People huddle together and they think it's safe in your home. You could be passing it to each other. They take it back to their homes and so on. So we also want you to advise that with public gatherings and meeting or social events, we want to keep it less than 10 people. If you can forego parties and celebrations and even weddings into the new year, that is wedding receptions, please avoid those. Otherwise, keep them very small. Even church services should be kept very small in number. If any residents are exhibiting any signs or symptoms of COVID, they should shelter in place. Watch for those symptoms about fever, cough, shortness of breath, congestion, runny nose, sore throat, loss of taste or smell, things that we recognize. And if you do get sick, you should be staying home for 10 days from the onset of your symptoms or from the date that you had your test done. And then you should stay there until you no longer are experiencing symptoms. It's usually about 10 days, and you need to make sure you're fever-free for another 24. Residents who are contacts of people that are sick, stay home for your full 14-day of your quarantine. You might get tested during that time, and even if you're negative, you could still become positive, so stay home. And also, residents who are either confirmed positive or a close contact should not wait for the health department to contact you. Immediately follow this guidance. That's the way we break the chains of transmission. And we also, lastly, would ask that all employers try to accommodate employees to work at home, and then businesses try to adopt online formats. The order is certainly available for full review, and we'll have it on our website, but this order goes into effect today, and it will be in effect till December 17th. That's 2 incubation periods, basically 2 14-day incubation periods for SARS-CoV-2 as recommended. So we'll revisit it after that time. I will give it back to Devin at this point.
For your words. We now have time for some questions from the media. As a reminder, we have a hard stop at 3 p.m., but please reach out to us if you have any additional questions. Furthermore, please mute yourselves when you are not asking a question, and please identify yourselves and your media outlet when asking your question. So with that, we can take a few questions, please. Any questions?
This is Dan DeRose with Channel 19 for both Armand Budish and Mayor Frank Jackson. We had the governor in Cleveland today and giving much of the same message, asking people to stay at home, although he's not going as far as a stay-at-home advisory. But as far as enforcement, we've already heard from at least one county sheriff who said he's not the mask police, he's not about to be the curfew police. What are you advising, Mr. Budish, for your county sheriff, Frank Jackson, Mayor Frank Jackson, or what are you advising for your city police department to do once we get to this curfew? Thank you.
I'm happy to start, and then Mayor, I'll turn it over to you. The answer for me is this is not something we're asking the police or the sheriff's deputies to do. This is something we're asking people to do, our residents to do. People have responsibility to do the right thing. I mean, you got to protect your fellow residents, and otherwise this is getting out of control. People need to take personal responsibility. They need to stay home if they can. They need to mask up. They need to social distance. They need to wash their hands. This is on individuals in this community. Otherwise, we're killing each other, and we can't do that. We're going to drive the businesses out of business if we don't follow these guidelines. So I'm just asking and begging people, follow these, please.
Well, as the county executive said, that it is not the intent to have this be a law enforcement thing. This is communication from us as leaders to people to express the severity of the pandemic and the fact that we have community spread, and to ask them to assist as community people to bring this back in line. We already have a mandate for masks, and we already have with our businesses a requirement on capacity and mask wearing and other things. We already have those things in place that have punitive measures associated with them. So just being punitive is not going to work here. Now, we'll continue doing our inspections of restaurants and clubs and bars particularly on the weekend. The governor has had a last call for alcohol that has been very helpful. So we have a mandate on mask and we enforce that, but we're not attempting to go out and just spot people and give them tickets for masks. What this is the fact that we yesterday reported 314 new cases in Cleveland. Mr. Allen at the County Health Board is talking about potentially 1,000 people a day next week or later this week. It's serious. And so what this is for us asking people to do their part in helping us flatten this spike and then help to reduce it so that there is not the necessity later on to have a statewide mandate, which the governor fully realizes is on the horizon if we can't get this done, which will result not only in businesses closing, but being out of business and layoff of people. That is what this is about.
Thank you for your question. Time for another question.
Yes, this is Dion Hampton with NBC News. I don't know that much about Cleveland, but I heard some numbers out that flew out, and I just want to make sure I get them confirmed. The third speaker, I'm not sure who he was, but he spoke after Mayor Jackson. He said something about 50 deaths in the first 2 weeks of November, and I almost got the impression that was staff members inside a hospital. If somebody can clarify that for me. And then I think what the mayor was just saying were the projections are moving forward. 1,000 people can catch the coronavirus per day. I don't know if that's the county or the city.
Well, I'll respond first and then Mr. Allen can give you the details. What we're saying is that we're in a spike and that yesterday we went from on November 4th, we were around 40 people, new cases. Yesterday, a couple of weeks later, we're 314. And a month ago, we were at the low teens and sometimes single digit. But Mr. Allen, Director Allen over the County Health Board can clarify what he said.
Thank you, Mayor. So what I said was that in the first 2 weeks of November, we tracked deaths related to coronavirus among the cases in the community. And so what we found was in our jurisdiction outside the city of Cleveland, so that's suburban Cuyahoga County, there were 50 people that died. And we've been seeing on average 3 to 4 deaths reported every day among people with coronavirus. So that's what I said. What I also said is that on top of the numbers the mayor just described for the city of Cleveland, we in suburban Cuyahoga County have been seeing about 500 to 600 new cases reported a day for most days this past week.
And that's in addition to our reporting.
Yes, in addition to your reporting.
Specifically say 1,000 per day. What is the 1,000 number we're speaking of? I wrote down 1,000.
Right. So the 1,000 number, if you start adding those together, we're getting actually close to it already, frankly, and that's what's scary. But what happens is that Case Western Reserve University has been doing modeling, that is predictive modeling, to get a sense of, based on the reports of cases coming in and what we're learning about people that are sick in the community and tracking the data. They've estimated that the case reports could rise to 1,000 cases a day across the entire county to 2,000 cases a day in the coming weeks across the entire county. So those models, I'm sorry, Mayor, go ahead.
And that's including the urban center, which is Cleveland, and the suburban communities. City of Cleveland has its own health department, so we keep our data, but we work with County Health Board, and they have data. So a combination of the two could result in that 1,000 to 2,000 per day. If that's right, Terry.
What county?
Yes, Mayor.
Cuyahoga County? Is that it? We're talking 1,000 cases per day in Cuyahoga County.
Cuyahoga.
Okay.
And let me just add here, the numbers that the mayor's been talking about and Director Allen's been talking, we are fortunate in this region to have great hospital systems. We have a lot of capacity. And that capacity has helped us all up till now. But I will tell you, at 1,000 or 2,000 cases a day, our hospitals are going to be overrun. That is a situation we can't afford to be in that situation. That's why the mayor and I are here asking the community, please stay at home, do the right things. But I will tell you, with 1,000 or 2,000